I was just about to celebrate my 50th birthday when I was diagnosed with prostate cancer. Happy birthday to me. And I elected to have the open prostatectomy as the operation and the form of treatment.
Because if I'd had any other treatment, it would have been impossible to have any follow-up. So I wanted to be sure that the treatment was final.
Radical prostatectomy is the complete removal of the prostate and seminal vesicle aimed in curing prostate cancer in its localised state. This is a well-established procedure and has an excellent track record and has been going for at least 30 years. It's suitable for those people with a greater than 10 and preferably 15-year life expectancy with localised prostate cancer where the cancer is indeed a threat to their life. The aim is to cure the patient of prostate cancer and give him the least number of side effects possible. We aim for what's called the trifecta, that is cure, urinary continence and erection potency. So what techniques can one use to perform this surgery? One can do this by the open retropubic route or by the laparoscopic route or by the robot-assisted laparoscopic route. So how does one choose which of these techniques to use? You need to be aware of the experience of the surgeon and the institution, and you also need to be aware of the side effect profile of the surgeon, and finally the most important thing is the experience of the surgeon. It's more important to have an experienced surgeon than the latest and greatest technique. When performing this surgery, one of the very common side effects are erection problems. This brings up the problem of being able to do what's called nerve-sparing surgery, which is a technique to minimise the chance of long-term erection problems. What the surgeon has to do is protect the erection nerves, but still remove the cancer in its entirety. You clearly have to be selective about which patients to do this on, and the things that might influence the surgeon in his choice may be the extent of the tumour, and also his experience, and also some of the findings that he may find at the time of the operation. Nerve-sparing surgery performed by an expert surgeon can yield excellent recovery of erections with time. It often takes 12 to 24 months for those erections to recover and often requires sexual rehabilitation. So what are the results of nerve-sparing surgery in expert hands? It very much depends upon the age of the patient, what his erections are like before the procedure, how experienced the surgeon is at nerve preservation, and how long after the surgery one makes the assessment. The ideal situation is a young patient who was fully potent prior to the surgery performed by an expert surgeon. In this setting, one can expect up to 90% recovery of erection functioning within 12 to 24 months. Overall, nerve-sparing surgery in large series has resulted in approximately 50% of patients recovering a reasonably good degree of erection function. When discussing radical prostatectomy with your surgeon, it is important to discuss the different types of radical prostatectomy, such as robot-assisted radical prostatectomy or the more commonly used open radical prostatectomy. Even laparoscopic radical prostatectomy, although not as commonly performed, needs to be discussed. The advantage of the minimally invasive techniques, that is, the robot-assisted technique or laparoscopic technique, is the speedier recovery, the shorter time in hospital, and the lowered blood loss. There is even early indications that there may be some benefit in terms of continence and potency, but these are as yet unproven. The advantage of the open technique is that there is a lot of experienced surgeons who perform this technique, and therefore that may lead to better outcomes than a less experienced robotic surgeon. There is, however, a general trend worldwide, particularly in the United States, to robotic surgery. Almost 70% of cases are now done with that technique in the United States. So with modern surgery, what outcomes should you expect? You should expect a high cure rate and a low complication rate, fairly short stay in hospital, minimal blood loss, a low incontinence rate, and a reasonable rate of erection recovery. These are expectations no matter who's doing the surgery or what technique is being used. So how can you as a patient judge whether the results of a particular surgeon are adequate? What's the benchmark against which you measure your surgeon? You need to know what the surgeon's positive margin rate is, his continence rate, and his erection recovery rate is. So what is a positive margin? A positive margin is where the pathologist reports after the removal of the prostate that cancer is up to the edge. What does that mean? It means you may have left some behind. That's a bad thing, and the best results are where the surgeon has a low positive margin rate. A benchmark positive margin rate really should be less than 20% overall, and for cancers contained to the prostate, that is PT2 cancers, less than 10%. The other two outcomes that you can ask your surgeon about are his urinary control rate and his erection recovery rate. One should expect a very low chance of serious ongoing urinary control issues, and certainly less than 3% in modern series is a reasonable expectation. It is, however, common to have mild urinary problems in up to 10%. What about erection recovery? It's important to emphasise that it can take up to 2 or even 3 years for full erection recovery to occur, and full erection recovery may never fully recur. One should expect in good hands, with nerve sparing, up to 90% recovery in the under 50-year-old age group, and between 50 and 70% in the older age groups, depending on how many nerves are spared and depending on what the erections were like before the surgery. So ask your surgeon, what's his positive margin rate? What's his continency rate? What's his erection recovery rate? What technique he prefers, and what's his experience level? These things will help you decide whether this is the right surgeon for you.